Hello, everybody. Welcome. And I hope that my talk is a little bit interesting for you. I'm talking about Buddhism and addiction, and I'll just give you a little bit of my background. Um, I grew up in a home where there was addiction and mental health issues, and um, and I know from a child how terrifying that was, how scary, how um, uh, not being able to count on anything to for anybody to be there when you needed them. And as I grew up and I left home when I was 17, I thought, now I'm going to be happy. Now I'm going to be okay. And I realized I wasn't. And I still kept running into people with addiction problems. And I wanted to understand, what was it about me at that point that um, caused all of this difficulty in my life. I spent my whole life blaming the others, but I started realizing there must be something about me in this. So I decided at some point I had already studied psychotherapy, but I decided I was going to study addictions. And having studied addictions, I thought maybe it would bring me some understanding about the addict, and also understanding of how it affects and what resources were available for families. And even to this day, there are very few resources for the families, although it is a family disease. And I'm saying disease loosely, it's not a medical disease. Dis-ease is a better word, I think. I'm going to start just by talking about the types of addiction that there are. And I'm going to name the ones that are pretty obvious: alcohol, um, caffeine, cannabis, the hallucinogens, so the hypnotics like sleeping pills and benzodiazepines and barbiturates. And then there's the inhalants like paint thinners and aerosol sprays, and prescription and non-prescription opioids such as codeine, oxycodone, and heroin, and prescription and non-prescription stimulants such as Adderall and cocaine and methamphetamines. And another one is tobacco, nicotine, so smoking cigarettes. And now we've got vaping has become an addiction. So those are the chemical addictions, but there are non-chemical addictions. There's gambling, eating, exercising or dieting, shopping, shoplifting, other risky behaviors. There's sex addiction or relationship addiction. There's people who have a pornography addiction, and there's video gaming and using the internet, such as your phone or a computer. These are types of addictions. And these are harder addictions other than the chemical addictions. Once you get rid of the chemical, the person can somehow get on with their life. But the chemical, for the ones that are non-chemical, that keep people doing these things over and over and over again, is adrenaline. And there's not much we can do about adrenaline because the body produces it automatically. So they're the harder addictions to deal with. Um, can you put up the first PowerPoint, please, Julieta? So I'm going to start with this because I think it's important to understand this when doing any kind of treatment. And part of it is that we have to look at it's called a biopsychosocial problem. So there's the biological risk factors, the psychological risk factors, and the social risk factors. And the biopsychosocial model of addiction provides a holistic, multifaceted conceptualization of a disorder. And rather than one cause, there are numerous causes biological, psychological, and social. And these increase or decrease the risk of addiction among individuals. Genetics play a part, biology plays a part, mental health concerns, trauma, cultural, social norms, and availability all contribute to the risk of addiction. And I'm wondering, as I'm saying this, what's going to happen now that they've made, in Ontario at least, the alcohol available in the convenience stores. I think we might see a few more problems. In light of the toll addiction takes on individuals, on their families, on communities, their friends, society at large, it's understandable that many people want to know the answer to the question, what causes addiction? And so why does one person end up using substances compulsively, despite highly negative consequences, while another person can use substance occasionally without a loss of control? So addiction can occur regardless of a person's character, regardless of their moral fiber or of their virtue. And decades ago, addiction was believed resulted from bad choices stemming from a morally weak person. However, that view has long been discredited by scientific research, and it's now known that biology plays an essential role in the disorder. And the American Medical Association declared alcoholism a disease that should be addressed with medical and psychological approaches. Now, I'm going to talk about alcoholism mostly because it gets too cumbersome to try and name all of the different addictions it can possess, can be. So alcoholism basically will just be the symbol for all of the addictions if I mention alcohol. So considering someone's biological makeup has its drawbacks, and research efforts have found that addiction is not that simple. There's no addiction gene or genetic sequence that accounts for all the variance in the experience of addiction. So instead, it is now known that many factors contribute to the development of an addiction. So we might think it's because of this, whatever it is that we say this is, but there are multiple factors. And so there are as many pathways to becoming an addict as there are addicts. So within this biopsychosocial model, we try to discover the causes of addiction. So the multifaceted disorder needs a multifaceted understanding. And we find that in the biopsychosocial model of addiction. So rather than pinpoint the one thing that causes addiction, we can now understand that a collection of factors contributes to a person being more or less at risk of addiction. And some aspects are universal. So, the reward system that alcohol or drugs can give you. So why is it that some people are rewarded by these drugs and others can take it or leave it? So the bio part of the biopsychosocial basically is genetics and biology are a part of the picture. And though it's not the entire picture, although there's no addiction gene to definitely identify a person as being a risk for addiction, it's evident through twin studies that addiction has a genetic component. And so some individuals are predisposed genetically for addiction. And it's a bit like schizophrenia. You can have twins, identical twins with the schizophrenia gene, and only one gets it. And there has to be, so that's the genetic component, but there also has to be a psychological component and a sociological component for that gene to be turned on. And there's no gene in, again, as I said, in addictions, but it works along the same idea. And some people have neurotransmitters that take the chemicals and they go into the brain and they go through the body and they produce a particular sensation. And some people don't have those neurotransmitters, so they can take it or leave it. They don't need to have it all the time. This is what we call in Buddhism conditioned existence. And this realization should help us to cultivate empathy for those with addictions. And it's very likely that others truly do not know how drugs make them feel. Their family members or their friends, their boss. And along with genetics, another contributing factor to the risk of addiction is one's psychological composition. And this factor is as broad as it sounds and includes personality traits. Some people like sensation seeking and impulsivity, and mental health concerns like anxiety and depression, or psychological constructs such as self-esteem or feelings of self-worth. And there's the psychological impact of an individual's life experiences such as trauma. So some individuals may be more affected by the rewarding effects of drugs of abuse because they are trying their best to regulate painful emotions. So there's a huge body of research, you can probably look it up, between trauma and addiction. And when there's been trauma, the individual, depending on it doesn't even really matter what the trauma is, it's traumatic to the individual. They may experience constant hyperarousal or hypervigilance or anxiety, and they abuse drugs that may be an effective way for them to regulate their emotional experiences. I know I've heard people, when they see street people who have alcohol or drug problems, and then they say how terrible these people are. And I say, well, remember, these people are self-medicating. They probably have a mental illness or something, an emotional illness that they are trying to treat. And when we talk about social, in the biopsychosocial, we're talking about social environment, the social norms, the availability or the accessibility or the legality, the modeling, some expectancies, societal approval, the cultural beliefs. These all influence the experience of addiction. So an individual exposed to drugs or alcohol at an early age can be influenced by social modeling or learning via observation. And additionally, certain environments have specific social norms related to alcohol or drug use. Everyone experiments with a little bit of alcohol or drugs when they're in university or in college. And the question to ask is, how do parents or caregivers handle stress? If a child sees their parent come home from work and they say, oh, I've had a terrible day, I need a drink, because they're stressed out, the child learns that in order to deal with stress, you have a drink. So they're not taught healthy stress relieving methods. And then on the flip side, children raised in homes where alcohol is not used at all, or maybe just a glass of wine with dinner. Now I'm going to take that out, because if they don't even see just a glass of wine with dinner, if they don't see it at all, if their family are what we call teetotalers, they don't learn how to handle alcohol. So when they're old enough to go out and party, they don't know when to stop, because they've never seen it used in a skillful, healthy way. So some communities are targeted more heavily with alcohol and tobacco advertisements. Don't see tobacco advertising too much anymore, but particularly probably in the States, you might see it. There's more availability of drug abuse than in other areas. So the social environment in which somebody exists contributes to their risk of addiction. So the factors that increase an individual's risk for addiction are numerous, yet they all find their place in the biopsychosocial model of addiction. And taken together, this model provides a holistic conceptualization of addiction that acknowledges the complexity of the disorder and provides guidance towards a solution. And there are many, which I will talk about, there are many ways to deal with this from a Buddhist perspective. So the more you know about this model, the more you can foster accurate empathy for those with addiction and work toward effective treatment and prevention efforts through compassion. So when it comes to addiction and recovery, there's no one size fits all. So the Buddha recognized addiction problems and advised his followers accordingly, although this was not the primary focus of his teachings. In Thailand and Japan, which have long-standing Buddhist traditions, have developed Buddhist-influenced responses to addiction. And the emphasis is on craving and attachment, and understanding of the workings of the mind, as well as practices to work with the mind. So Buddhism lends itself as a rich resource to assist addiction recovery. Now, the 12-step movement has been an impetus to making use of ideas and practices from Buddhism, but in particular, mindfulness has started to be used to support addiction recovery with promising results. So exploration of other areas of Buddhism is beginning and may provide additional benefits, hopefully in the future. So Buddhism primarily addresses the human mind. Gautama, the founder of Buddhism, who lived in an area corresponding to northern India and Nepal 2,500 years ago, sought solutions to the existential issue of suffering, especially old age, sickness, and death. And through his own quest, he found deliverance from suffering in a state called enlightenment or nirvana, and becoming a Buddha, literally one who is awake. And the Four Noble Truths are one of the Buddha's earliest core teachings. The first noble truth is dukkha, suffering or unsatisfactoriness. And the second noble truth is the cause of suffering, which is craving. And craving is closely associated with attachment. It's part of the three poisons: attachment, aversion, and ignorance. The craving and attachment each reinforce the other and contribute to suffering. And the third noble truth is the cessation of suffering, which is enlightenment. And the way to lead to the cessation of suffering is the fourth noble truth, which is the Noble Eightfold Path. And it consists of right view, right motivation, or intent, sometimes it's called, right speech, right action, right livelihood, right effort, right mindfulness, and right concentration. And with the emphasis on craving and attachment, as well as how to overcome them, the Buddha's teachings invite consideration of how they could be relevant to the problem of addiction. So I'm going to talk about how addictive behaviors have been seen in early Buddhism and responses to addiction in countries with long-established practice of Buddhism, while exploring how Buddhism has affected approaches to addiction recovery in North America and Europe, where Buddhism has been practiced seriously for more than half a century, probably closer to 75 years now. And responses to addiction here include the use of mindfulness, adapting the 12-step program, and more recently, developing more integrated Buddhist approaches to addiction recovery. So I'm going to talk about early Buddhism, mostly as it's described in the Pali Canon, and practice in the Theravada, and Mahayana Buddhism, including Zen and Pure Land. So Julieta, could you put up number 2, please? PowerPoint 2. There you go, that's it. The Buddha identified craving and attachment as the leading causes of suffering, and addiction can be described as a severe type of attachment. So the driving force behind addiction is the desire to avoid pain and experience pleasure. And if people can overcome their attachment, this will allow them to beat their addiction. So in early Buddhism, there appears to have been an awareness of some of the dangers of addictive behavior. And principally, the Buddha seemed to have encouraged his followers to avoid addictive substances and behaviors by drawing attention to their unwanted consequences. And there's also some evidence of simple advice being given to modify addictive behavior. So ethics is the foundation of Buddhist practice, being the first part of the threefold way. In the ethics, meditation, and wisdom, the Noble Eightfold Path. And the Buddha gave guidelines for ethical behavior, such as the 5 or the 10 precepts, or in the case of monks and nuns, the hundreds of precepts. But the 5th precept, number 5, is abstention from intoxicants that cloud the mind. And this has been variously interpreted as meaning either complete abstention from intoxicating substances or moderate use that is insufficient to cloud mental faculties. So the Buddha pointed out that intoxicants could lead to loss of wealth, increased quarreling, susceptibility to disease, losing a good reputation, indecent exposure of the body, and weakening of intellect. So the intoxicants referred to in the early scriptures are fermented and distilled liquor, probably because alcohol was the chief intoxicant available. And the Buddha also recommended avoiding gambling, citing that the winner makes enemies, the loser grieves for his losses, the loss of wealth, his word is no longer trusted, he's despised by friends and associates, and he's not in demand for marriage, since he would not be seen to be able to afford to maintain a wife. That's in the Digha Nikaya, if you want to look that up. And some of the approaches the Buddha took to the problems facing his followers could be considered to be similar to modern behavioral approaches. So this would be cognitive behavioral, probably method of treatment. On one occasion, the Buddha gave a program for a king who had a tendency to overeat, leading to slothfulness. Slothfulness being one of the things that prevent us being able to meditate properly, or even to practice any of the Buddha's teachings properly. And the Buddha utilized the assistance of a family member in this case. So he instructed the king's nephew at each meal to prevent the king from eating the last mouthful of food on his plate. Then the next meal consisted of just the amount that the king had eaten at the last meal. And this went on, so that gradually the king had less and less to eat at each meal. And the prince was given a verse by the Buddha to recite if the king complained about being stopped from eating the whole plateful, reminding the king of the reasons for the program. And in time, the king was reported to have lost weight and regained his former vitality. And in Buddhist cosmology, the hungry ghost, preta, may be considered to be an early description of the state of addiction. The hungry ghost is one of 5 or 6 realms, traditions vary on the exact number, into which one can be reborn after death. And the particular realm being the fruit of action, karma, of the previous life. And the other realms are the hell realm, the human realm, the animal realm, the heaven realm, and the jealous God realm, the asuras. And in Zen, we see these realms that we can be in any one of those realms any time of the day. So it's not a place you go. It's our state of mind. And the hungry ghost realm is described as a state of intense and unsatisfied craving. So hungry ghosts are referred to in most schools of Buddhism, including Theravada, but are particularly well known in the West from depictions from the Tibetan Wheel of Life, an image that includes all 6 realms and is frequently found at the entrance to Tibetan temples. And the hungry ghost is shown as pot-bellied, huge big belly with a tiny mouth. The mouth is the size of a straw, the opening of a straw. And any nourishment is difficult to take in. And when it reaches the belly, it causes great pain. So contemporary writers have likened this to the state of addiction, when vain and compulsive attempts are made to ease painful inner emptiness with external substances and objects. So, I talked about earlier sex addiction or relationship addiction. When somebody feels empty inside, no matter how much sex or how much they follow their so-called love object around, it's not enough. They are empty. So this is the realm of the hungry ghost. So in Thailand, they had to do something in response to a growing heroin problem, and it became an epidemic in Thailand. And one of the monasteries in Thailand developed a program to treat addicts. And individuals are admitted for between 10 and 28 days. The monastery, by the way, is called Thamkrabak. Probably not pronouncing it correctly. So they're in for 10 to 28 days, and treatment consists of herbal medicines, taking a vow, meditation, chanting, teachings on Buddhism, and work. Sounds like a regular retreat. And for detoxification, there are no opiates or other Western medications used. The emphasis is on purification, which is said to be assisted by the herbal medicines. And some of the herbal medicines act as an emetic, which, while others have a more soothing effect to help with sleep, the emetic causes them to throw up. There are herbal teas and herbs that are used in a steam bath, also to promote purification. And the main herbal treatment was originally developed by a nun called Saraburi. And the Buddha is sometimes referred to as the great physician. And in Buddhist countries, lay people have often turned to monks and nuns for help with physical and psychological, as well as spiritual problems. So viewing spiritual growth in terms of purification is found from early on in Buddhism. So the vow, sajja, it's a Pali word meaning true, and also means a solemn assertion of the truth. And it is seen as a prerequisite to entering the monastery. And the vow is taken in the context of a simple ceremony led by a senior monk. And the person solemnly promises to abstain from all addictive substances and not to encourage anyone else to use addictive substances. It doesn't matter what background the person is from, whether they're Buddhist or Christian or Muslim, they take this vow. And breaking the vow is seen as to have an adverse consequence for the individual. So to underline the seriousness of this vow, participants are only allowed to enter the monastery for treatment once. And the meditation is optional, as is receiving a gatha or a mantra. And these gathas and mantras are intoned silently during meditation. So it's different types of meditation are used. So I think the person is allowed to choose which meditation they use. And these mantras are used to help at times of crisis or difficulty, such as when craving for the drugs or the alcohol. And the Buddhist teachings focus particularly on ethics, intending to reform the antisocial behavior that may be associated with illicit substance use. Some statistics were done, and I'm not going to bore you with all the statistics, but they found that at the end of when they did a follow-up, 2/3 who used intravenously, mostly between the age of 15 and 25, abstinence at 6 months, validated by urine drug tests, was 20% from Bangkok. And if they were from outside of Bangkok, 30% if they were from provincial cities. And the opium smokers who were older, over 30, came from rural areas, and almost all were employed, and they had an abstinence rate of about 50% at 6 months. So within the neighboring countries, say Laos, the government treated people who wanted help at the monastery, and some were treated at a medical facility. And the treatment at the medical facility included methadone detoxification and counseling, and participants could choose which treatment to attend. And those choosing the monastery tended to be older and included more female and ethnic Lao, who are ethnically similar to the Thai. And the people who chose the medical facility were more likely to be urban and educated, or from a tribal group who were mainly non-Buddhist. And follow-up at 6 and 18 months showed no difference in abstinence rates between the two groups, although the monastery had a higher mortality rate among those over 60. And the subjective rating of treatment at the monastery was positive among Lao addicts, but negative among the tribal addicts. Now, when I was doing research on what the mortality rates were, I think one of the things that people don't understand is that alcohol is probably the most dangerous drug to come off of. So if you're an older person and you're coming off of alcohol and you go into a treatment program right away, you have to be detoxified of the alcohol. Otherwise, you can go into seizures and die. So it's a much more dangerous drug in that case. Now, the Westerners who attended this monastery suggested that participants had a favorable attitude toward the program, and felt that the induced vomiting helped with craving. But there were some concerns about the health risks, and it was a bit of a coercive nature of the program. And I'm going to talk a little bit about this coercive nature later and the effects. Julietta, could you put up PowerPoint 3, please? Now, in Japan, they have something called Nikan therapy. And when they're treating addicts, they give them this diagram that you can see. And at the end, they do it at the end of each day. Now, I have given this to just some of my own students to say you can do this every night if you want. And you can pick a person, you can pick a profession, you can pick the day. That can be your focus. So what did you receive from that person or from that day? Or your job? What did I give? And the third one is, what troubles and difficulties did I cause? So people look very, very closely at this. So Nikan was developed in the 1940s by Yoshimoto Ishin. He was a Japanese businessman. He was a devout practitioner of Jodo Shinshu Buddhism. And he had practiced a strongly ascetic form of Shin Buddhism called Mishrabi, which was self-examination. And when he experienced this, he realized it led to profound happiness. And Shin is a form of Pure Land Buddhism that emphasizes faith rather than willed effort. And faith is developed from a recognition of the boundless compassion that one receives from life and one's own inherent tendency to self-centeredness. So Ishin created Nikan, and he did this so he could share his experience through a more accessible form of practice. And Nikan literally means inner, like Nai means inner, and Kan means looking. So it's introspection. And it's based on these three great questions. What have I received from person X or job X or day X or whatever? Person picks what that's going to be. Oftentimes it's person. And what have I given to this person? And what trouble have I caused this person? And the question what trouble has caused to me, to that person, is ignored, since one is usually already aware of the answers to this question, and reflecting on it seems as unhelpful. The first person reflected on sometimes you have your mother, or by different family members, loved ones, and friends. When I gave the workshop, one person focused on her father, who she had a terrible relationship with. And when it was at the end of the workshop, she said, I realize I caused my father no end of suffering. So she started to realize, even though she'd always blamed her father as being the person who was always the trouble in the relationship, she realized that she was just as bad or worse. So it's a good form of self-reflection. There are two forms of Nikan. One is called Shuchu Nikan, which means concentrated self-observation, and it's practiced in a retreat setting. I've done this once at a retreat, gave a Nikan retreat. And the Bunsan Nikan, or dispersive self-observation, which is practiced in daily life, which is what I just talked about with that form. And a retreat typically consists of spending a week in solitude, reflecting on three questions. So you're given a week by yourself in a small room, and You might just focus on the first question, and then somebody comes in. I would go in partway through the day and look at what they've written down and say, there's more. And they always come up with more. So it's, again, you have to, it's deep reflection. So after each session of reflections, they last 2 or 3 hours. That's when, there's an interview. And initially people can struggle with the reflection, but as time goes on, memories are likely to become more vivid. So the effect of the reflection is said to be cathartic. So as I said, the one person who had the difficulty with her father, it was very cathartic for her. And the aim of Nikan is to help people move away from self-centeredness and blame to a sense of gratitude, which leads to increased happiness. So anytime I've done Nikan, even if it's just a small workshop or at that retreat, all the feedback was quite positive. So Nikan has come to be seen as a Japanese form of psychotherapy, and although its founder was happy for it to be used in this way, he did not conceptualize it as a therapy. He saw it, Nikan, as something to be practiced by anyone. And as a psychotherapy, it has been used to treat alcoholism and other forms of addiction since the 1960s. Now, Greg Kretsch, who I have had some interactions with Greg Kretsch a few years ago. He's the head of the Toto Institute in Vermont. And he suggests that the key difference between Nikan and traditional forms of psychotherapy include focusing on facts rather than on feelings. So reflecting on past care and support rather than hurts and mistreatment. So helping the client to understand others rather than validating the client's feelings, and taking responsibility for their own behavior and problems rather than blaming others. It's providing a framework for self-reflection rather than analyzing and interpreting the client's experience. And it helps the client have appreciation for life rather than self-esteem. And it has been used successfully in addiction treatment, or at least counselors using it with addicts, getting some positive feedback. And there are many centers around the world. The only one that I know of, and I'm sure there are others, is the Toto Institute in Vermont. So Takimoto and colleagues reported a follow-up study of 129 patients with alcoholism who were treated with Nikan, and they found 53% abstinence rate from alcohol after 6 months. Everybody's aware of mindfulness. Mindfulness in early Buddhism. So mindfulness is the central practice. It's essential to the practice, anyway, of Buddhism. It's included in many of the important formulations of the path, such as the Noble Eightfold Path and the 7 Factors of Enlightenment. These are found in the Majjhima Nikaya. And the principal Pali word that is translated as mindfulness is sati. which is often linked to a related term, sampajana. Sati refers to paying attention to experience in the present moment. And the Satipatthana Sutra is teaching about this mindfulness practice. And basically, it's derived from the verb to remember, and has a connotation of recollecting yourself. It's clearly knowing, which in this context refers to understanding the data that is gathered through paying attention to present experience. And it's also in understanding that phenomena are impermanent, which gives rise to wisdom. So typically, mindfulness is cultivated through paying attention to bodily sensations. The coloring of experience. That is, whether it's pleasant, unpleasant, or neutral. And to emotions and volitions. And also through applying different frameworks, different dharmas, such as the Four Noble Truths, to contemplate in your individual experience. And it can also be directed to broader aspects of experience, such as external environment and other people. So mindfulness can be developed at any time. You know, we say whether standing or walking, seated or lying down. But also when excreting. People probably lose mindfulness as soon as they go into the washroom. So in a more focused way during meditation, especially meditating on the breath, the mindfulness of breathing. And the aim is to gradually build up a more and more continuous awareness of your experience. And this sustained awareness is used to train the mind, especially through which mind states are cultivated in which let go of and to see clearly the nature of experience, to liberate the mind from misunderstandings, avidya in Sanskrit, ignorance. And these misunderstandings lead to suffering. So John Kabat-Zinn first developed the use of mindfulness as a therapeutic modality, and he set up stress clinics in Massachusetts. I don't know how true this is, but he attended one mindfulness retreat with Thich Nhat Hanh and never went back again, but started up the mindfulness stress reduction, I can't remember the name of the program. Anyway, mindfulness stress release for people who are stressed or anxious. And he provides an 8-week course that taught mindful meditations such as body scanning, mindfulness of breath and body, mindful movements based on simple yoga exercises, Tai Chi, and informal mindfulness practice. Being mindful to daily activities such as eating, washing up, and walking. And this can be used in the addictions. You do this with people who have an addiction. Have them practice all of those things. Mindfulness of body and breath, the mind. But there's also such a thing as a mindfulness-based relapse prevention for addiction. So after the client has cultivated increased attention through mindfulness, um, it suggested itself as a possible adjunct to prevent relapse. And relapse prevention has to be something that is offered to all people after they have finished, after they have stopped using. And it could go on, it needs to go on for at least a year. My understanding from talking to people at different stages is that 3 years is a critical time. After 3 years, people sort of become complacent and they might start using again. So addiction, like depression, is associated with high relapse rate. So the emphasis is on relapse prevention. And so mindfulness-based relapse prevention offers a possible approach to preventing relapse into addictive behavior. And although mindfulness was initially seen as a possible tool to prevent relapse, with its usefulness in helping a wide range of emotional difficulties and improving well-being, it is increasingly being viewed as an adjunct to support a patient or a client's overall journey of recovery. So it's important that it be done. In my experience working in the addictions field, those people who did not attend relapse or didn't stay in a relapse program always relapsed. Those people who stayed in it, some of them went years and years and years and years without using again, maybe the rest of their life. And I believe that if they have a relapse prevention program, some support afterwards, there's an 80% chance of them recovering well. There is a program in Australia I've heard about called Parents Under Pressure. And it teaches mindfulness to parents on a methadone program. And the project aims to help parents maintain their focus on their children and to be able to regulate their emotions. And the sort of randomized controlled trials showed that those on the parenting intervention with mindfulness improved their parenting. Their children's behavior improved, and they reduced the dose of methadone that they were taking, and eventually being able to come off of it. And mindfulness has been used to help with smoking cessation. I did this program through the Lung Association in Hamilton. They contacted me, could I run a smoking cessation program? And I said, okay. And I use mindfulness as a way of practice with them, along with the stages of change, which I will be talking about. But I had one man come in. I had to do an intake with the clients. An intake, how much do you smoke? How often do you smoke? What seems to be a trigger to smoking? Do you drink coffee? All of these things, and why are they coming to the program? And so this one man came in and he said, I don't smoke. And I said, oh, so what's the reason you want to come into this? He says, because, and then he told me the story of having been in a traumatic, terrible car accident. He was in a coma for, I don't know if he said 2 years, it was a long time. He was in a coma, when he came out of it, he didn't know anybody. He didn't know his wife. He didn't know his children. Um, Before he was in the accident, he smoked 2 packages of cigarettes a day. After the accident, he was not one bit interested in smoking. After 6 months, he started regaining some of his memories. He said he fell in love with his wife, even though he didn't know who she was. They stayed married. And after a certain period of time, he said he noticed every once in a while, I don't know if you can see this, but he used to go like this. And he didn't know why he was doing it. And his friends told him, that's where you used to keep your cigarettes in your pocket there. And he says, I don't want to start. So that's why he was there. I can't remember, that was so many years ago now, I can't remember what we did. He just came to the meetings, and he was very helpful with people, other people in the group. So it can be used for smoking. So any kind of addiction, mindfulness can be used for. So this is an example. It helped by learning to develop awareness of automatic processes. For him, the automatic process at that point was going like this. But some people just automatically pick up their package of cigarettes or automatically buy them without even looking deeply at what's going on with them when that happens. So we teach people to look deeply at the causes of their conditioned existence. And mindfulness can assist people with addictions to stay with and accept difficulties rather than block them out. Learning to be with difficult emotions that can help break the link between negative effect and relapse-related thoughts and plans. So learning to be with urges and to step out of compulsive thinking. And that can certainly help reduce the likelihood of relapse through mindless obsessing. Thus, mindfulness may be able to both sensitize to automatic processes and desensitize to negative emotions and thoughts. And mindfulness appears to help depression, anxiety, stress, poor emotional regulation, and avoiding coping. And both addiction and some mental health disorders such as depression have a common stress vulnerability and problematic rumination. So both may be helped by attention training of mindfulness and learning acceptance. I was running a mindfulness meditation program here, and the very first night, everybody came and seemed to know each other, but we're all surprised that they were all there. And it turns out they were all psychiatrists. And there had been an article in the Journal of Psychiatry that month that mindfulness meditation can help with addictions and depression. So that's why they were all there. They wanted to learn how to do it so they could help their patients. Julietta, could you put up PP4, please? Or P4? I don't know how I have it numbered on yours. That's it. No, that's not it. Round circle, that's it. So this is the Buddhism in the 12 steps. And this is step 1. It goes around. I don't know how well you can read it on my screen. It's very small. But God is at the center. The gray area is me. And then, so God is at the center of it all. So a number of Buddhist writers and teachers have sought to adapt the 12-step approach for Buddhists, or infuse the 12 steps with teachings and practices from the Buddhist tradition. And typically these authors have been in recovery from drug or alcohol addiction. And for some, their involvement with the 12 steps has led to seeking further spiritual support and sustenance. And for others, recovering within the 12 steps has rekindled an earlier interest in Buddhism or complemented concomitant practice of Buddhism. And the issues that these authors have faced is getting so far in their recovery, perhaps with the aid of the 12 steps, and then getting stuck or struggling with how to integrate a practice of Buddhism. And being an addict in 12-step recovery, what do? Some feel that the 12 steps may not address deeper levels of attachment to addiction. At least in its widest sense. And even while being appreciative of the help of the 12-step approach, some find that the language can be off-putting or applied in a dogmatic way. Some 12-step groups are experienced as having an evangelical Christian flavor, which can lead to those in recovery to seek an alternative form of mutual aid. I did have a client once who would not go to the 12-step meeting because she said, as much as they say that God is whatever you believe it to be, they mean the Judeo-Christian God. And she was not within that. In fact, in my memory from 30 years ago, I think she had a more pagan spiritual practice, but she did not want to go to AA. And AA was all that was available in the 50s. And my father's excuse for not going, he was an atheist and God was the focus of the meetings. So it pushes certain elements of the population away, the addicted population away. And the most obvious point of connection between Buddhism and the 12 steps is meditation. Meditation is a cornerstone of Buddhist practice, and meditation, together with prayer, is included in the 11th step in AA, in the 12 steps. And Buddhist teachings on meditation have been used to provide practical guidance for practicing and elaborating the 11th step. But more generally, the writers have drawn on their experience of Buddhism and being in recovery to augment the spiritual dimension of the 12-step program. Other areas of overlap between Buddhism and the 12 steps include having a description of suffering in life and its causes, and an ethical dimension to overcome suffering. So step 1, admitting to God their powerlessness over alcohol, or admitting that they were powerless over alcohol. And it has been linked to the first 2 noble truths, which are suffering and the cause of suffering, namely craving. And steps 4 and 5, the fearless moral inventory and admitting the exact nature of one's wrongs, can be related to sila, or ethics, the precepts, which is the first stage of the threefold way. The Dikha Nikaya talks about this, and as well as the 3rd, 4th, and 5th limb of the Noble Eightfold Path. And the principal Buddhist influences have been Theravada, especially Vipassana, and Zen. And both tend to emphasize mindfulness and make reference to key Buddhist teachings such as the Four Noble Truths and the Noble Eightfold Path, and includes the Mahayana elements such as the Bodhisattva vow and bodhicitta. And a bodhisattva is a being who dedicates their life to helping all other beings, thus emphasizing the altruistic dimension of Buddhism. And the bodhicitta can be understood as the inner aspect, as the experiencing the urge to help beings. So according to the Mahayana, on becoming a bodhisattva, an individual takes a vow or a series of vows that supports his or her altruistic behaviors, such as vowing to master all teachings. And koans can be used, a problem without a logical solution, to meditate upon and use in discussion groups. If that's helpful, I think that's great. In my teaching of koans, the person's given a koan and they don't discuss it with anybody else because it's up to them to come up with the whatever the resolve is. But this operating within the discussion group is good because it's like peer support, and this acts as another bridge between Buddhist practice and the form of silent meditation practiced alone or with others, and the 12-step format of discussing issues in groups. And as I mentioned before, there are some recognized stumbling blocks that some people in recovery may encounter when trying to follow a 12-step program. Terms God, faith, powerlessness, and prayer may alienate those without a religious training or have rejected their religious upbringing. So Buddhism may offer an alternative to the Judeo-Christian emphasis on as much of the 12-step, as much as is seen in the 12-step literature. And some people use higher power in terms of various Buddhist ideas and practices such as karma, mindfulness, love, wisdom, compassion. And there is no doubt that the 12 steps have helped many, many people. No doubt about that. However, when studying addictions, this is my own personal view, I became aware that many addicts have replaced their addiction with another addiction, the 12 steps. And because the 12 steps is very, I don't know if evangelical is the right term, but I knew a person who had been a member of AA, and they had been a member of AA for a long time. This was an older man, and I think he'd been a member of AA for something like 35 or 40 years. He had terrible anger issues, and he was going to Montreal to visit his family, and he was worried he wasn't going to be able to find a meeting to go to. And I said, well, how long are you going to Montreal for? And he says, I'm going for 4 days. I said, you can't miss a meeting for 4 days? He says, no, I might get drunk. And I said, when was the last time you had a drink? He said, 35 or 40 years. I think it was 40 years ago. There was still that fear if he didn't go to meetings, excuse me, he was going to get drunk. And he had all kinds of anger issues, which he had never addressed. And towards the end of his life, even though he was a very old man, his wife told me she's going to leave him. She can't deal with his anger anymore, and she didn't want his anger around their grandchildren. So AA doesn't address everything, or at least he wasn't working all the steps properly, possibly, I don't know. And another person that was in AA that I knew, we were going for coffee. This was years ago, and he had not had a drink for, I don't know, something like 15 years. And he ran into somebody he had known in AA years ago. He'd gone to AA for 40 years and never got clean and sober. So he stopped, he decided to go into some therapy, and he had intensive residential therapy. And at the end of that, he never drank again. For, I don't know, 40 years, he couldn't stay clean and sober with AA, but with the therapy, he could. And he ran into somebody from AA who said, oh, I haven't seen you for years. He says, yeah. He says, no, I don't go to AA anymore. And she says, well, you're going to get drunk. He said, how long have you been sober? He said, I don't know, 35 years. So it's a long time, 20 years maybe. She said, well, you're going to get drunk if you don't go to AA. So this is the thinking that I mean when I say it becomes another addiction. It becomes like a cult at that point. And I'm saying this based on my observation and also observing I've seen people who only got clean and sober through AA. So I think it, again, not all treatments are for all people. Another alternative, you know, some people, they've sought a Buddhist approach to recovery based on the 12 steps, but some have been exploring a Buddhist approach to recovery that might look like taking the Buddhist teachings as the starting point. And this is Noah Levine's program that he's put together. And I can't pretend that I know a lot about his program. And I don't know if his program still exists because of some problems that he had within his community. But the first truth in his program is that addiction creates suffering, and the second, as the cause of addiction, is the repetitive craving. So this is very much with the Buddhist teachings. The third truth states that recovery is possible, and the fourth is the path to recovery is using the Eightfold Path with ethics, meditation, and wisdom. So, and his is, there's a strong emphasis on taking refuge in the three jewels. So that's the Buddha, the Dharma, the Sangha. And the Sangha for this group of people, their Sangha would be the people who attended the meetings, that would be their Sangha. Now, 8-step recovery. Can you put P5, please, Julieta? I think that might be it. Yeah. So there's an 8-step recovery program. So step 1 is accepting that this human life will bring suffering. So in step 1, they accept that this human life will bring suffering. They learn to face their pain. And they do this by noticing noticing their pain with mindfulness. They begin to notice that their pain, they begin to notice their pain with a calm mind. They learn to stop, pause, and slow down. This is for all suffering, so it's not just addictions. Stop, pause, and slow down. We occupy, they teach that we occupy breath and body and become aware of what's going on in the mind. And they're taught to reflect on this precious life, that death is inevitable, actions have consequences, and unsatisfactoriness is a part of everyday life. And step 2 is seeing how we create extra suffering in our lives. So in step 2, we realize that we create more suffering in our lives. Every time we move away from pain, we multiply the suffering in our lives. We need to learn to sit with calm mind, sit with the pain. And we begin to do this by identifying the things that trigger us in the high-risk situations that may bring about a relapse. And the people are taught that they must remember that their thoughts are not fact. They do not have to believe their thinking. They can create space whenever they feel at risk of reaching their addiction. Or overwhelmed by the intense feelings of craving. And by practicing the 3-minute breathing space, which they have within their program. It's 3 minutes. It's a 3-minute meditation that is done. And step 3 is recognizing impermanence. Recognizing impermanence shows us that our suffering can end. So in step 3, they learn to embrace the fact that there is an end to suffering, that everything in our lives is impermanent, including their addictions, including their compulsive and obsessive behaviors. And they learn to accept that change is possible. They begin to pay attention to small changes in their lives, and they do this by practicing one of the meditative exercises to help slow them down. And step 4 is being willing to step into the recovery path and discover freedom. So in step 4, they need to be willing to step onto the path of recovery and connect to a vision that is greater than their addiction or their compulsive behaviors. And they learned to begin to identify things they want more than their addiction. And they can begin to discover this new freedom by cultivating loving kindness in their lives. It's like blowing onto hot coals. After a while, a flame arises. So they learn to keep on diligently practicing loving kindness toward themselves so that one day they will choose the path that leads to recovery instead of the path that leads to their addiction. And step 5 is transforming our speech, actions, and livelihood. In step 5, they learn to transform their speech, actions, and livelihood. And with an attitude of kindness, they review their past actions. They acknowledge them and their impact on us and others. They make amends and plan to do something different. And they take their gifts to move forward in their recovery and commit to living their lives more in line with the 5 precepts. They also acknowledge the consequences of their addictions and have healthy, compassionate regret. And if they make a promise, they make a plan of action before promising to let go. And if they are able, they admit to another human being the exact nature of their actions and to give themselves forgiveness. And step 6, placing positive values at the center of their lives. These values will support them in their recovery. They recognize that their addiction is a false refuge and cannot bring about true happiness and contentment. And they go for refuge to a community that offers the ideal of recovery, sobriety, and abstinence. That could be their addiction community, the addiction recovery community, or it could be joining a temple or a center. They can get some support there too. And step 7 is making every effort to stay on the path of recovery. So they're likely to have to feel the unbearable pain of not turning to their addiction. And they ride the harrowing waves of recovery with calm. And they know that every time they surf the pain of recovery, the waves will become calmer. So they surf the waves with calm by preventing unhelpful states of mind from arising. And they eradicate them when they do arise and cultivate and maintain helpful states of mind. And through this, they get to know their minds by identifying their dominant hindrances. And they breathe. And step 8 is helping others to share the benefits that they have gained. So this helping others to share the benefits I have gained is the wording I think they have. So they learn to help others with a place of kindness and share the recovery with others. They continue to cultivate their 5 new senses of faith, energy, mindfulness, concentration, and wisdom. They don't teach recovery, they radiate recovery. They live their lives as people who have stepped onto the path of recovery and freedom from their addictions. Now, I've met the person who came up with this program is Valerie Mason. Well, it's actually Dr. Valerie Mason John, and she did it with another person whose name is Groves, I believe. And they also draw on the Four Noble Truths and the 3 refuges and stress the importance of meditation. And this course forms a foundation, and there are influences from cognitive behavioral approaches to working with addiction, as well as others. So although this and Levine's approach are explicitly Buddhist, the 12 steps perhaps unsurprisingly seems to hover in the background. So Dr. Mason John has made suggestions for setting up 8-step recovery groups, which appear to be beginning to form. The Buddha was aware of the problems caused by addictive behavior, especially drinking and gambling, and gave advice to help his followers. His main focus, though, was helping people to attain enlightenment, as he had done, and which is characterized by wisdom and compassion. And after his early disciples had, like the Buddha, gained enlightenment, he encouraged them to teach the Dharma out of compassion for the benefit of others. And the response of the monastery in Thailand, the heroin epidemic, can be seen as a continuation of his compassionate activity. And similarly in Japan, Ishin's development of Nikan appears to have been a compassionate response to pass on what he had discovered in a form that was accessible to a wide section of society. And this work has then been extended to include helping people with addiction problems. And the wisdom side of enlightenment includes a detailed understanding of the workings of the mind. So with clients, that's the focus. It's practices to help move towards enlightenment. Now I'm going to finish up with one last hopefully one last, because I know I've gone on a long time, is Gabor Mate, who wrote a book called In the Realm of the Hungry Ghost. And in present awareness, we are liberated from the past. The difference between passion and addiction is that between a divine spark and a flame that incinerates. So passion creates and addiction consumes. And at the core of every addiction is an emptiness. And Mate said it's based on abject fear. So this particular book emphasizes the importance of understanding addiction as a complex issue rooted in trauma, societal factors, and brain chemistry. And Dr. Mate argues that addiction is not a moral failing or a lack of willpower, but rather a response to pain and disconnection. Mattei reveals the significant impact of childhood trauma on the development of addiction. Mattei explores how adverse childhood experience can shape individuals' brain development and increase their vulnerability to addiction later in life. He argues that addressing addiction requires addressing underlying social issues, such as poverty, isolation, systemic inequality, rather than seeing it as an individual problem. And Dr. Mattei challenges the stigma surrounding addiction and advocates for compassion and trauma-informed approaches to treatment. And he emphasizes the importance of providing support, understanding, and non-judgmental care to individuals struggling with addiction. So Mattei argues for integrating harm reduction strategies, such as safe injection sites, which is a big problem now when they're closing them down. The safe injection sites are needed alongside with traditional abstinence-based models. And if we go back to the first part when I said pre-contemplation, which I will talk about now, pre-contemplation is great for people to have in safe injection sites. So can you put up P6, please? So the stages of change, this model is 5 stages that people go through when changing their behavior. So pre-contemplation, they're not ready. In contemplation, they're getting ready. And then there's the preparation stage. And then there's the action stage and the maintenance stage. So they're called the general steps. They observe people taking stages of change or changes of behavioral change. So understanding people's readiness to change by being familiar with the 6 stages is really helpful if you have somebody come in and you're trying everything you can using all of the Buddhist techniques, and they don't want to do it. Or they'll do it one day, but not right now. So pre-contemplation, individuals in the pre-contemplation stage, a stage of change, are not even thinking about changing their behavior. They might not even see it as a problem. It's your problem, not mine, is their attitude. Or they think that people who point out the problem are exaggerating. And there are 4 reasons for this pre-contemplation. One is reluctance. The second is rebellion. One is resignation, and one is rationalization. So reluctant pre-contemplators are those who through lack of knowledge or inertia, do not want to change. So the impact of the problem has not become fully conscious. And rebellious pre-contemplators have a heavy investment on drinking and making their own decisions. They're resistant to being told what to do. And resigned pre-contemplators have given up hope about the possibility of change, and they are overwhelmed by the problem. And many have made an attempt to quit, but they don't stay. And rationalizing pre-contemplators have all the answers. They have plenty of reasons why drinking is not a problem, or why drinking is a problem for others, but not for them. So when family members pester somebody to go into treatment, or if the courts mandate somebody into treatment, if the person is in pre-contemplation, the treatment will not work. So contemplation is the individuals, they're willing to consider the possibility that they may have a problem. And that possibility offers hope for change. So at that point, they're interested in learning about their addiction and the treatments. They know that, say, if they're drinking, that it's causing problems. They may even have a mental list of why drinking is bad for them. But even with all these negatives, they still cannot make a decision to change. So in the contemplation stage, they're just thinking about it. They're looking at the pros and cons. But in the preparation stage, they are kind of determined. They've decided to stop drinking, and they've weighed all the pros and cons, all the risk-reward analysis, and finally they dip into the balance in favor of change. And most individuals in this stage will make a serious attempt to stop drinking in the near future. Individuals in this stage appear to be ready and committed to action. And they want to go through the action, but they're beginning to anticipate problems and pitfalls, and to come up with concrete solutions that will become part of their ongoing treatment plan. So they're still looking at it. But then there's implementing the plan. Again, whatever the treatment, when you're using Buddhist results, the individuals in this stage put their plan into action. They start looking at meditation. They start becoming aware of how they're feeling with their addiction. They made a public commitment to stop using. And it's really helpful that they make a public commitment, because once the public knows, you're more likely to want to stay on the path. I say this even with giving the precepts. If a person does not have a family member or friend with them when they take the precepts, they're maybe not necessarily going to stay on the path. So it's a public commitment. So it's helpful for them to see that there are people who are watching and cheering them on. Nothing succeeds like success. So a person who has implemented a good plan begins to see it work and experiences it working over time, making adjustments along the way. Excuse me. And the things that their addiction has taken away from them begin to be restored, along with hope and self-confidence and continued determination not to use. And the final stage is maintenance. Maintenance is, the new behavior has become self-sustaining. It takes place of drinking or drug using and their associated behaviors. So the action stage takes maybe 3 to 6 months to complete. Once it's completed, people are now in the maintenance stage. The real test of change is long-term sustained change over many years. And this stage of successful change is called maintenance. And in this stage, say, an alcohol-free life is becoming firmly established, and the threat of a return to old patterns becomes less intense and less frequent. And because something like alcoholism is a chronic disease, the possibility of relapse is always present. Individuals may experience a strong temptation to drink and fail to cope with it successfully, sometimes relaxing their guard or testing themselves against a slide back. But people at this stage of change are armed with a variety of relapse prevention skills. And they know where to get the supports that they need. and relapse is almost a given. So alcoholics who relapse say, learn from the relapse. So the experience of relapsing, returning to sobriety, often strengthens a person's determination to stay sober. So the ultimate goal in the change process is determination. And at the end of determination becomes the end. They're no longer, it's no longer a fear of relapse. The alcohol or drug is no longer a temptation. So I'm finished talking now. I'm just going to end with something for you to remember. In all treatment modalities, non-harming is the first step. Buddhist ethics says that once you understand how the mind works, doing the right thing has a lot to do with feeling good. And the purest, cleanest shot of dope will never, ever take you away from to doing deeds of kindness for someone else. So you will never be able to do deeds of kindness when you are high on something. Not a genuine. I mean, we won't get into the reasons why people might do it, but it'll make my talk way too long. And the very last thing I want to say is to give to your clients that better than drugs is compassion. Compassion and loving kindness. So I'm going to leave you with that today.
Thank you, sister. Thank you so much.